morning, good morning, morning, good morning, morning.
Welcome back to the morning show on Tobago Updates Television, and thank you for staying with us. We begin conversations this morning in studio, and we speak with Dr. Trudy Kawal, a consultant urologist, and Kerry Neptune, a senior nurse, and we're speaking about men's health awareness. Good morning, ladies, and welcome.
Good morning. Thank you for having us.
Of course, a pleasure to be here, and for you guys to be here. And as we're talking about men's health awareness, is something that we seldom talk about. Men tend to shy away from because of the nature of a man. And they think that they are strong, which they are. They are very strong and powerful, but it is very important also for them to check in and ensure that they are in a good place, that they are healthy. And so we want to talk about the importance of them being aware of where they are in their health and the services that are going to be provided to ensure that they are, healthy.
Thank you. So you actually hit the nail on the head there with that statement about men not wanting to seek healthcare when they are well. And a lot of men wait till they get symptoms or they feel really unwell. And at that point, sometimes it's a little bit late, or something that they had that was completely treatable becomes something that cannot be cured. And I'm talking specifically about prostate cancer. Now, as men get older, there is the inherent risk of prostate disease. And that doesn't always mean cancer. Sometimes the prostate just grows and increases in size, and it causes some symptoms in the urinary passage. Now, prostate cancer in its earliest stages actually has no symptoms. But if you wait and you don't check and it progresses, then by the time you present with pain, bone pain, pathologic fractures, blood in the urine, sometimes the cancer has actually spread already and we're not able to do anything curative. And why it's important to talk about prostate cancer is that men that are Afro-Caribbean or of African descent, the research done locally has actually shown that they tend to have higher rates of prostate cancer, as well as when they are diagnosed, it tends to be more aggressive disease. And so that is why urologists throughout the region have made a big push to encourage prostate cancer screening. The reason being, if we pick it up early enough, it's something that's completely treatable, something that's curable, and something that once it's picked up and dealt with, a man will live his normal lifespan and die later on from something else. So that's why it's important that we screen and that we try to pick up these prostate issues.
And you mentioned that there is an aggressive approach in terms of the public awareness for men to see the importance to get the testing done, if they have any symptoms to get checked out early so that it can be detected and possibly cured. What has been the response, especially in the Caribbean region, as you mentioned, Afro-Caribbean men? I know for a fact that I personally know some men who will not step forward to get the assessment or to find out what is happening with them because I don't know if it's a cultural thing or whatever it is, but what has been the response in terms of going out there and trying to encourage these men? Listen, we need to find out what is happening with you, not because you're standing, feeling strong. Sometimes you're feeling pretty okay and you don't do anything, but with women, what we do, you go and you get your checkup every 6 months or whatever. You go and get, just to make sure you're in good, healthy standing. But with men, it's a bit more difficult. But what has the response been since you have been trying to actively engage men in coming forward to get their health checked?
I think so far we've been having a positive response, more and more with the use of social media and more information just being disseminated out there. A lot of men now request a prostate checkup. I think the elephant in the room that needs to be addressed is always the rectal examination. That is what makes most men shy away from seeking that sort of prostate cancer screening. So prostate cancer screening in our setting involves the use of a blood test called the PSA, or prostate specific antigen, as well as a rectal examination. Now, some men fear this, and culturally, this was something that used to be frowned upon. But what I tell my patients, it takes about maybe 10 seconds or less It's not painful. Yes, you might have a little bit of discomfort, but it's always better that you do it and you get it over with. So once you've done it, once you've done your screening, and you'll know if you need anything further, any further treatment, or if you're good for another year or two, depending on your age, how often you need to be checked. And once people get over that fear, they tend to have, most men, when they undergo prostate cancer screening, they say, doc, it wasn't as bad as I thought, or it wasn't as bad as I anticipated that it would be.
That's right, because it really is just in the mind. And I think for them, from what I understand or what I've had conversations with other men, it feels a little bit emasculating. But it really isn't, because as you mentioned, sometimes it takes, 10 seconds to get it done. And 10 seconds can literally save your life.
Yes.
And so it's very important that men come forward to get this screening done and to ensure that they're in a good place. To ensure that it can be detected if there's anything to be detected, as you mentioned, and to get the kind of advice and consultation in terms of moving forward. What are some of the, you mentioned earlier some of the symptoms. I suppose that those are the progressive symptoms. What are some of the early symptoms that men can kind of question and say, hey, maybe I need to go and get checked out?
So as I said, in its earliest stages, prostate cancer actually has no symptoms. As it progresses and it spreads to the bone or outside of the prostate, men might get bone pain, weakness, difficulty walking. And in most men, as they get older, they will start developing some type of urinary symptoms. That has to do with enlargement of the prostate. Now, it doesn't always mean it's cancerous, but if you find as a male getting older, you start to experience frequency of the urination. So having to go to the bathroom 2-3 times within the hour, getting up in the night frequently to pass urine, feeling like you can't hold it up, like you're going to actually urinate on yourself, straining or forcing for the urine to come out. While the urinary stream is coming out, it starts and stops. Just a decrease in the rate of flow, or even feeling like after you've just finished passing urine, you feel the sensation of incomplete emptying, or feeling like there's urine still in the bladder that didn't come out. All of those are symptoms that may be attributed to an enlarged prostate. Now, it doesn't mean that there's cancer in the prostate, but it means that you should get checked out just to see what's going on.
To eliminate, right. I understand that totally. And what is the age group that you would recommend men start testing?
So internationally, the age group to start testing is around age 50 to 54. However, there have been some urologists within the Caribbean that advocate for screening as early as age 40 in Afro-Caribbean men because we were seeing high numbers and high chances of aggressive disease. What I tell my patients is that usually I start around age 50. However, if the patient has a high family risk or family history of prostate cancer, meaning the person's father's brothers or father's brothers, because it's in the paternal line, then I would advocate from age 40, 45, or 10 years before diagnosis.
Wow. So, you have to check your family history.
Yes.
To ensure that, maybe you're safe, or maybe I should check myself out. And even if your family, even if there isn't any history in your family, you should still, get checked out, because you never can tell what is happening there as well. And, not to be morbid, but in terms of the rate, the death rate for prostate cancer here in the Caribbean, and I can localize it to Trinidad and Tobago, what has it been like in your experience?
I can't recall the exact numbers of the mortality rate coming out of the National Cancer Registry. However, prostate cancer is the leading cause of cancer mortality among men in Trinidad and Tobago.
Wow, that is very, very alarming. And, so it's even more important for our men to come out. And, I want to take this opportunity to encourage our women to be that support for our men and encourage them to go out, because it takes a lot for a man to take himself up and go, because men are so strong and men are so self-sufficient. It takes a lot for a man to step forward and get this done. But I do know that as you mentioned, doctor, that 10 seconds could literally save your life, could detect something and can save your life. What kind of encouragement do you really want to give men this morning, for them to really, put themselves aside, put the strength, the I am a man aside, and step forward and say, listen, it is very likely that this might be happening. It might not be happening, but it's better for me to know. How would you want to encourage a man to say, listen, let me go and get screened?
So what I would say is the I am a man thinking is the same thing. You, as a man, you want to take care of yourself because you want to take care of your family and you want to be there for the people in your life. You want to have a good quality of life for all the years that you do live. So knowing that this is something that's treatable, potentially curable if it's picked up at an early stage, you just have to bite the bullet and go.
That's quite right. I like how you say bite the bullet like a man and go
Yes.
and get it done. Ladies and gentlemen, we have to go for a short break. We're speaking with Dr. Trudy Kawal, consultant urologist, and Kerry Neptune, senior nurse. We're speaking about men's health, primarily prostate cancer. So we do hope that you stay with us when we come back from the break. We have to go for a short break. And as we go, we invite you to help us. Share the live, share the live, share the live. We'll be right back.
Good morning.
Welcome back to the morning show on Tobago Updates Television, and thank you for staying with us. We continue conversations this morning with Dr. Trudy Kawal, consultant urologist, and Kerry Neptune, senior nurse. We're speaking primarily about prostate cancer screening for men, of course, and we're talking now about the opportunity for men to come forward and get screening done, and of course to see the results, and just the opportunity for them to know whether they're in a good place or to get the advice as to how do they move forward should you detect anything. So now we're talking about this promotion that is going on. Tell us, what is this happening and what men can expect when they come to the screening?
All right, so we have this session that is coming up. It's taking place on the 17th and the 18th of August. It has extended to this Sunday due to the overwhelming response that we received about women being so concerned about the men having this test done. So it went into the Sunday, so now it's the Saturday and the Sunday.
Well, I'm happy that there's I'm really, really happy that there's an overwhelming response.
Yes.
So it shows that men are coming forward,
Yes,
showing interest in that. So that's very good.
Yes, they are. Right. So when you come in on this particular day, you would have been pre-booked for your time that you're going to be coming in. It starts from 9 to 5. The doctors would be on standby waiting on you. The nurses as well will be present waiting. We're going to be doing basic vitals, and then you're going to go in to have your chat with the doctors as well as your tests. You have the option to have a conversation with your doctors when you go in to discuss your way forward on the screening process you would like to have, which is going to be comfortable for you, right? We encourage men to come out, share the word, send the message around. Let the men come out. It's a free entity. It's being given back to Tobago via the Gulf Coast Radiology. Therefore, we encourage the men to come out.
Okay, and where is this located?
It's located down at Miss V, down at next to Coast Guard base, where Miss Francis Auto Fashion is. There's where it's taking place, where Ultimate Ultrasound is.
And with these types of screening is something that is very, very personal, and of course confidentiality in terms of protecting, again, the man's strength and his image. We can be confident that they are in the strictest of confidence, and that they're.
Yes. Definitely. Confidentiality is high on the list when it comes to persons coming in to have their tests or whatever they have to have that.
So on site, there will be doctors and nurses and all the medical.
Yes, there will be doctors, there will be nurses, there will be the technicians on board to do the blood test, the PSA, and to have things done.
All right, so walk me through the process of what a man can expect when he comes into this space to get this screening. I mean, not with all the graphic details, but in terms of, to mentally prepare them to know, okay, this is what is going to happen. Because as doctor said earlier, sometimes it's a stigma. They get scared, and then by the time they get in there, there's like, well, we finished, that's it. So just, talk them through that and give them that measure of confidence and, reassurance that it's really, really easy, really simple, and 1, 2, 3, and it's over.
All right. So basically what we're going to say is when you come in, you're going to meet the friendly nurses who are going to welcome you. Then we are going to do the vital signs. So doing your vital check is a basic, is a normal stuff that's supposed to be done on a regular health check, right? So we're going to alleviate some of the fears there by making you feel comfortable. After this turn, we would have already spoken
Before
to
you
the...
move forward, Doc, when you say your vital, just for those who...
Okay, so the vitals would be your blood pressure, your blood sugar, and urine tests, right? So we check in the urine to see what's the components we're going to find. If we're going to find protein, if it's going to be normal, if we're going to find sugar, whatever we're going to find in the urine, right? And this is just for basic knowledge for when they come in, because some persons have never gone to a doctor to have any type of check done, right? So we're going to start at that point. After you would have finished in the pre-book, they would have been issued the doctors who they are going to be going to, right? Don't be afraid if when you enter the room, it's a male. If you go in and it's a male and you prefer to have an escort of a female in the room to be comfortable, you can request same, right? There are going to be female doctors as well. However, all these doctors maintain confidentiality and professionalism in doing their tasks, right? So therefore, when you go in, it's just to be comfortable, sit and speak with your doctors on a one-on-one, have that conversation with them. If you so wish, you can bring your significant others or your spouse or whoever that is going to alleviate some of that fear so that you actually have someone next to you going through this process.
You know, you said something while you were explaining what is happening, what is going to happen. And you said sometimes some men never go to a doctor in their lives. And I was at a conference last year, I think it was, and they were talking about, it was a men's conference, and they were talking about the fact that a woman, she would go she would see a doctor when she's born. She would see a doctor when she's pregnant. She would see a doctor for so many different reasons. A woman would go to a doctor to get checked, right? But a man is when he's born and probably when he's sick and almost dying is the only time he would see a doctor. And so that's why it's very important. And I like the fact that this opportunity has come up now so that men can see a doctor not only when they are sick, but the opportunity is there for them to check to see if they are sick or if they are not, rather than waiting for something to happen for them to treat. Instead, now they have the opportunity to know that what their status is. And, you know, I applaud you guys for doing this. And I do hope that some things like this are done on a consistent basis to help our men in our local societies. As you mentioned before, that you know, men in this type of men, they kind of, it's difficult for them to do it. And I'm happy that you have so many, it's so subscribed that you have to do both Saturday and Sunday. Is there room for more people to subscribe or is it fully booked?
At present, we have just few more spaces left on Sunday. So you would like to take the opportunity as we speak or after we are off the set to contact the number that is on the flyer to pre-book yourself or your loved one or your spouse to have this cancer screening done.
And the number to call is 687-4311. That's 687-4311 for your booking, to make your appointment, to ensure that you get a spot only on Sunday because Saturday is fully booked, right?
Saturday is fully booked.
Right. You know, I really, really hope that as the men have made the appointments, they come out, and we do hope that, you know, the results are good. And even if they are not, I know that you are providing that measure of support as to the way
additional
for the way forward, right? Is there anything else you want to share with our viewing public before we close?
Well, we just want to encourage persons out there who have seen us this morning, who is the first time that you're going to be exposed to this information, to make use of it. Encourage the men to come out. Gulf Coast Radiology has offered this service. They're giving back to Tobago. They've been in existence for more than 5 years. So they're just giving back to Tobago. So we encourage you all to take full exposure of this event and make it the best that you could.
Of course, and I agree with you there fully. Ladies and gentlemen, we've been speaking with Dr. Trudy Kawal, consultant urologist, and senior nurse Kerry Neptune on the fact on the prostate cancer screening and the fact that there is a men's health awareness campaign coming up on Saturday 17th and Saturday 17th and Sunday 18th, forgive me, of August there at the Gulf Coast Radiology Limited on Milford Road by the Coast Guard area there. And it is absolutely free of charge from 9 a.m. to 5 p.m. on both days. To register, call 687-4311 to make your appointments and get your screening done. It is very important to know your status where this is concerned. All right, ladies and gentlemen, we have to go for a short break before we continue conversations in studio. And as we go for a break, we invite you to help us. Share the live, share the live, share the live. We'll be right back.